Parasites can invade the central nervous system through various routes. These include ingestion of larvae in undercooked food, fecal-oral transmission, contact with contaminated water, and bites from infected vectors. To cause infection, parasites must breach the blood-brain barrier, a critical defense system protecting the central nervous system. Once inside, parasites affect the central nervous system in several ways. They can directly invade brain tissue, causing immediate damage. Parasites may migrate to the meninges and blood vessels, disrupting blood flow and causing inflammation. Some form cysts or granulomas, creating space-occupying lesions that compress surrounding tissues. All parasitic infections trigger inflammation and immune responses, which can sometimes cause more damage than the parasite itself. These pathological processes lead to a variety of clinical manifestations. MRI scans typically reveal characteristic lesions in the brain, as shown in these images. These lesions correspond to areas where parasites have invaded or caused inflammation. Clinically, parasitic central nervous system infections commonly present with several symptoms. Seizures and epilepsy are particularly common, along with headaches, mental decline, and various neurological deficits that reflect the location of parasitic lesions. Neuroinflammation plays a crucial role in the pathogenesis of these infections. Parasites trigger both acute and chronic inflammation in the brain. This process disrupts normal glial cell function, compromises the blood-brain barrier, and can lead to significant neuronal damage. The result is often lasting neurological deficits that persist even after the parasite has been treated. Looking ahead, there are several critical areas of focus in addressing parasitic central nervous system infections. These include developing improved diagnostic tools that offer rapid and sensitive pathogen detection, researching biomarkers to predict inflammatory responses to treatment, understanding climate change impacts, and strengthening public health infrastructure for disease surveillance and new therapeutics. Climate change is expected to significantly alter the geographic distribution of disease vectors and parasites. This habitat suitability map shows how regions previously unsuitable for certain vectors may become viable habitats by mid-century, potentially introducing parasitic diseases to new populations with no prior immunity. Another critical challenge we face is the increasing prevalence of antimicrobial resistance in neurological infections. The growing resistance to current treatments underscores the urgency of developing novel therapeutic approaches, combination therapies, and global surveillance programs. Targeted drug delivery systems that can cross the blood-brain barrier are particularly important for effectively treating central nervous system infections.